A lot of people suffer from jaw pain, jaw clicking, all sorts of symptoms involving their jaw, and they often don't know what to do about it. Sometimes it is a dentistry issue, usually the more extreme cases, but for all those cases that aren't, we're left wondering what else should we do. I'm Dr. Rodney White with Sapi Chiropractic, and today we're going to run through a real life case with a jaw issue. See, as chiropractors, we deal with this a lot. What a lot of people know is TMJ, because TMJ stands for temporomandibular joint, which is the jaw joint here. And when that gets dysfunctional, it can create a lot of problems for people. It tends to get more dysfunctional when we're under a lot of stress as well, because we tend to clench our jaw and do a lot of that kind of stuff. So next time that happens to you or someone you know, find a chiropractor who deals with these kind of conditions, and they should be able to help you out. And we'll talk through why in a minute, but Caitlin, who works for us, has actually been undergoing some treatment here because her jaw has been an issue. Pain, inability to open it all the way, some popping and clicking and all those kind of things. So as a chiropractor, number one, we're going to deal with her jaw, and the jaw treatment is very easy, very painless. We'll show you what all of that looks like. Number two, we make sure we adjust the neck as well. We're not going to show that one today, but there's a couple factors there. When we get the neck adjusted, all those nerves that supply all the jaw muscles are going to function better, which means your brain hopefully will switch off a lot of the spasm that's going on. But getting adjusted also is being shown to help the brain calm down the stress that we get when we're under stress all the time. We get into this fight-flight response, and that then overactivates the nervous system. So the adjustment alone of the neck can calm down that, but when the jaw is also its own problem, we have to deal with that too. So thankfully, Caitlin's been nice enough to be a crash test for us here. So what we're doing as a chiropractor is first of all assessing how is the joint working, because when we have a jaw issue, normally we want the jaw to spin and then open, but if one side's getting jammed, the other side will spin. So if the left side's jammed, and the jaw will deviate that side when we open our mouth. So the first thing we want to do is check that. So Caitlin, you can open your mouth all the way and close. And now she only has a very, very slight deviation because we've been working on this for a handful of treatments and she's almost 100% resolved. But early on, she couldn't open her mouth enough to even see the deviation there. So open again for me and close. So now what we do, we're just going to put some gentle pressure along the jawbone here, the mandible, and help keep that straight as she opens to help the stuck part of the joint open up. So open for me and close, open again. And we'll probably do that 3 or 4 times depending what's going on. Then we have to deal with the muscles above and below that are in a lot of spasm. So this top one up here, I'll put pressure on, and we'll just a little bit of a gentle pressure there, and she's going to open. See, she already knows the treatment, and close. And we might do that 2 to 3 times there. Then even more gently, we'll come down below the joint, and you're going to open again and close. Now, the combination of that, as well as getting adjusted in the neck, some people it can take a week, sometimes 3 or 4 weeks, depending how long you've had it. That will almost certainly help or maybe even clear up the problem in full. But then there's certain stretches you can do at home as well to help those same muscles. So you can mimic this same thing. If you do have jaw problems, you can go onto your temple muscles here and lift them up with some pressure on it and open the mouth all the way. So Caitlin, just while you're lying here, we can demonstrate that. So you're going to put your fingers right here up on your temples. So you bring your hands up, put a little bit of pressure like that, and just open your mouth all the way. And hold it for a second and then close it again. And then another really good one we can do, so you can do that a few times. Then there's another one you can actually hold onto your bottom teeth, and it's called a resistance exercise. So you're not trying to pull your jaw open, you just open halfway, put pressure on it with your hand, and try and close your mouth, but don't let your mouth win. So your hand holds just strong enough to keep it like that. That one you might hold 10 to 15 seconds and then repeat 3 to 5 times. So you can do all those exercises at home as well, but if you're not getting the result you want, then ask the chiropractor you go to if they deal with extremity joints and especially jaws. If they do, then they'll be able to probably solve most of those issues for you. And if you are an extreme case, there's some really good dentists out there. We have a couple in Omaha who work specifically with jaw issues. If you have to get referred to them, it's a longer process because there's so much more going on, but there's always an answer. So don't keep suffering. ask your chiropractor if they can help you if you are dealing with a jaw issue. If you don't have a good chiropractor in the Omaha area, we'd be more than happy to take a look at you and see if we can help. You can just go to sapicaro.com to see what we're all about.